That's why I say with somebody that's got menopausal symptoms, I could see that if they were really out of alignment, that it could absolutely have a benefit and impact on them to help with that. Is it the only answer? No. Is it the answer for every person? No. But that's why I've always combined everything as well. So anyways, long story, but there you go. I've seen people that have been constipated,
Yes, I
low
bet.
back stuff, and man, you get their back adjusted, and all of a sudden they got to go to the bathroom, like run. It's like, oh, it's fascinating, but that's a nerve thing. But it's not a nerve thing that's so serious that they need to go to the ER because they've got problems. It's just there's a block, in the nerve function, and so once that nervous system is cleared, it's like, it's all of a sudden that communication can come through. So. But I know it's all, that's why I say our bodies are so fascinating, and I think it all works together. All works together.
Nothing happened. I mean, she's been doing some, she's been typing a lot at work. It could be carpal tunnel.
Okay.
Do you fix carpal tunnel? Okay, can you adjust it?
Well, yeah. Well, so carpal tunnel, I mean, so that one is another one it's kind of a randomly misdiagnosed sometimes. If it's, because the true carpal tunnel is going to affect the thumb and the first two digits, right? Because it's just compressing the tunnel right there, the median nerve right there at the carpal tunnel. But if it's anywhere else in her arm, it could be anything coming from her neck. It could be from her upper shoulder, upper arm. And if she didn't do anything specifically to it, it could be if she, her posture. What I'm seeing a lot is people's posture in front of the computers now that they're at home working from laptops in awkward positions because they're curled up on their couch with their laptop working all day, right? Versus sitting at a office chair with the right ergonomics. And they're having all kinds of funky symptoms, whether it be neck pain or numbness in their arms and hands because, it's just their head, their 10-pound weight is what I call it. Their 10-pound weight is like really putting too much, it's like too far forward. So it's where in her arm is she having pain?
Just it goes up her whole arm, but mostly her wrist. So I gave her a lot of oils, and now it's better. It's like way 75% better than it was at one point because it used to wake her up with the pain at night. And she took a couple of days off work, and then of course it got better because she wasn't using it. But she's still like, oh, maybe it's broken. I'm like, first of all, you didn't do anything to break it. Second of all, if it's fractured, then no one's going to do anything but put a splint on it, which we have a splint on it. I was like, so if it's sprained, you can't see it. So I was like, I don't know, but you can go get an x-ray just so you can stop thinking you broke your arm typing because you literally do nothing.
Well, and you know me, I'm so completely conservative. I don't even like to send people for x-rays unless they truly had trauma or they've got some serious nerve stuff going on, just to make sure there's nothing major, right?
Right.
So, I mean, it's possible, that we could just do a little work on her and get it feeling better.
Yeah, I mean, at minimum, she's been laying in the bed. She probably needs probably something on her back that needs to be adjusted, and then her arm will feel better. It's probably her back, but
yeah, a lot of time it's a neck. The neck is the big culprit for lynch, and it was my I think I was my 5th trimester, and so my wrists, both sides, were just like throbbing to the point that I was having trouble holding a pen. They would hurt so bad. And as you know, I mean, when we're at that stage, we're either in class or studying like 20 hours a day. It's ridiculous. So my head's hanging over books all the time. And so when I go to the student clinic at the time, the way they have it set up for chiropractors is our first, the first time we go, we have our own little clinic for all the interns that are they haven't seen real patients yet. The first real patients they're seeing are all students to kind of have a way to practice without practicing on actual patients, right? So I was going to the student clinic and they were working on my hand and my wrist and my forearm and just, muscle tissue, soft tissue, adjusting my wrist, doing all this stuff, stem, all this stuff to my arm. I go see my chiropractor and he does a simple little muscle test and it basically put my pinky to my thumb together and he muscle tested me. And he's like, oh no, he goes, it's your neck, it's not your wrist. And I'm like, what do you mean? And it was just, all these things that we have learned, but kind of pulling it all together to see And so, yeah, he adjusted my neck, and immediately my wrist pain started to decrease. And it was just because my posture had been so horrendous. Of course, being chiropractic college, you would think that would be the opposite case. But yeah, that was where I really realized, holy camole, it's, how much pain in the arm and the hand and the wrist can come straight from the neck, right? And I've had a lot of people that thought they had carpal tunnel, and I start working on their neck. Not that I'm saying that, there are people that truly have carpal tunnel as well, because I have had patients that have had true carpal tunnel and they've gone and had the surgery to release that tendon and relieve the hand pressure. And let's work on this, because I have a feeling it's coming from there. And the symptoms in the hand and wrist go down quickly, or arm as well. So shoulder, I've had people with shoulder pain. They thought it was a shoulder, and it was not the shoulder. So
right, you're correct. Yeah.
Yep.
But so you think the chiropractic care for carpal tunnel syndrome is successful?
Yeah, absolutely. Well, it can be. Of course, you got to look at the cause, right? If it's something that can be worked upstream, I say upstream, like up the neck or in the shoulder area, and it's just relieving some nerve interference, yes. If it's truly just the compression of that median nerve on the carpal tunnel, sometimes that tendon does get really tight, or people that have like overuse injuries, I say like, I would say like plumbers or electricians, people that have to use their wrist a lot of rotation and torquing. Sometimes that area does need that release, and they go in and just basically slit the tendon to give some freedom, so there's not such pressure on the nerve in that wrist area. But yeah, no, absolutely, I think so. I've had success with it. So
yeah, I figured. Like I said, because the way she's been laying in the bed, and I know it's not trauma because she's done nothing but lay in the bed. So I'm like, it probably is carpal, and I'm sure that somebody can do something without. You're not going to get surgery. Sure, you just need to rest it. You don't need surgery.
That's like my last resort for any.
Well, me too. I mean, carpal tunnel surgery is like, no, you're not going to get that. So many people just splint it and rest and.
Yeah.
And she's taking a week off, so she'll be able to rest it, and hopefully it'll be better by then.
You know what's crazy? There's sometimes I've had people, and when I was pregnant, that was the one symptom I could not figure out with all the nutrition that I did. I mean, every symptom that I had pregnancy, I could pretty much fix with nutrition, except for my hands. And I was getting, and I don't know if it was the swelling, if it was a hormone thing.
Oh yeah, pregnant women get it because all that extra fluid and all your tiny compartments get affected. Yeah.
And it was mostly just my hands, but I think too, because I use my hands so much with work, but my hands would ache. I mean, it was just like, oh my gosh. But I've had a couple of patients that have had that as well. And I'm like, I don't know the answer for them. I mean, we could work on it. We could do some muscle work on it. But I haven't figured out the answer. Of course, I was breastfeeding, and I went to this MD to see, okay, what are my options? And he's like, the only thing was cortisone. And he, I was breastfeeding, so that wasn't an option. Now, within about 2-3 months after I had work, the pain in my hands was gone, but that was excruciating, and I couldn't, for the life of me, figure out what to do nutritionally, what I could change, add, delete. I increased water, I cut back salt, I added all these nutrients, and I don't know. Do you have any answers for that for women that were pregnant that have that hand pain and all that?
No.
No. Okay.
I mean, it's just because you've got all that fluid, you're not going to drain the fluid. They'll just put it right back there, and all they can do is just like anyone else, rest the hand and put the brace on. Extra B vitamins, because sometimes there's some vitamin that's nerve.
Yep.
That the nerve wants, but no, usually it's just the weight.
Okay.
Eat less salt, so maybe you won't be so swollen, but you can't diurese them, because a normal person, if the fluid was compressing it, you could give them a diuretic. Not that I ever did that, but I'm just saying, like, theoretically, it's been done. So I'm like, no, that's something. It's just like, oops. Usually women who gain, how much weight did you gain? Because people who gain like a normal amount of weight don't have the problem, but somebody who's like gains 80 pounds in pregnancy, they might have some compression.
I think I gained like 35.
Oh, so you were normal. So yeah.
I think the day that I had him, I ended up at 42 pounds, but I literally gained probably 6 or 8 pounds within 2 or 3 days of having it. It was just like all of a sudden I was like, whoa. That was pretty, but it was fluid because I had him and I was looking back at pictures, and within 3 weeks I was almost back down to normal again. So I don't know. I think I gained a lot of fluid. So that's probably why I was having so many challenges with my hands too. But yeah, that'd be interesting to have an essential oil or a fix for that, for a natural fix for pregnant ladies.
Yeah, and back then I wasn't playing.
That was rough.
Yeah. At that time I wasn't playing with essential oils so much. So I wouldn't have told anybody to do an essential oil, but now, I mean, yeah, you would have an option of using like something kind of soothing, but you'd still have the fluid. I mean, at the end of the day, I'm not going to get rid of that fluid.
Right, exactly.
And I only let you have, I was talking to somebody today and I'm like, I only let you have like 6 essential oils when you're pregnant,
Yeah,
so
when you're pregnant.
I'm kind of stingy with them.